vascular system is composed of different components: the arterial system, the venous system, and the lymphatic system. Let's do another question brought to you by Boardmaster. We have a 65-year-old man complaining of pain in his right calf that occurs after walking several blocks and is relieved by rest. He has a history of hypertension, hyperlipidemia, and smoking 1 pack per day for the past 40 years. Blood pressure is 140/90, so he's hypertensive. The right lower extremity appears pale compared to the left one, elevated, and exhibits delayed capillary refill upon lowering. Okay, so we know there's a perfusion problem. Palpation reveals diminished dorsalis pedis pulses and posterior tibial pulses, supporting that there's a perfusion problem here. Looking at the labs, we see that his cholesterol is in fact elevated. Specifically, one thing we need to focus on is the LDL cholesterol, which is the worst out of the bunch here. Which of the following anatomical structures is most likely compromised in this patient? The answer here would be B, the popliteal artery. So you might be thinking to yourself, why isn't it the veins? We have the great saphenous vein, we have the small saphenous vein, and then we have the femoral vein. Well, if it was a venous issue, specifically if it was a superficial venous issue, we would see signs and symptoms of varicose veins or venous insufficiency, rather than arterial claudication symptoms. Similarly, for the femoral vein, we would see a DVT or deep vein thrombosis, swelling, warmth, and redness in the leg rather than ischemic pain upon exertion. Here are the key takeaways for PAD that we can go over. That was another question brought to you by Boardmaster. Don't forget to like, share, follow, and I'll see you in the next video.